First of all, I'll start off by telling you that we are thankful we don't have any case of Ebola in Malaysia till date. The reason why we call this mainly is to inform Malaysians and the Malaysian public on our level of preparedness to face this global epidemic which is happening at this point in time, and to what an extent we have put in mechanisms. The National Crisis Preparedness and Response Center, or CPRC, is the center which is continually monitoring the disease surveillance and monitoring of the status of Ebola in the West African countries and other parts of the world, and how we should respond to the spread of this disease. Ebola is a notifiable disease in Malaysia. So far we have got 9 people who came with fever from Western Africa, mainly from Nigeria, whom we have tested, and they all tested negative. And at the present time, we actually have started screening at points of entry. Points of entry means all international airports, that is KLIA 1 and 2, and the other international airports like Penang, Kota Kinabalu, Johor Bahru, where every person who comes is actually screened for body temperature. And if there is high body temperature, they are taken away and they are being questioned. Otherwise, the next point is all those who come from these countries at the immigration counter. The immigration counter will look whether they have in the last 3 weeks visited any of the affected countries. And if they have visited any of those affected countries, then they will be asked to go to a quarantine area within the airport complex itself. Then they will be questioned as to possible contact with a patient with Ebola. If there is no contact with the patient with Ebola, they will be advised, counseled, and allowed to go. If they had a contact with a patient of Ebola, we have decided and we discussed, even if they're asymptomatic, we will put them under supervised quarantine for 21 days, of supervised quarantine. And after that, if they are okay, we will say they are safe. So that is for those who are asymptomatic, who come from countries which are affected. For the present moment, that is Guinea, Sierra Leone, and Liberia. Although Senegal and Nigeria had cases before, but they have control and they passed the 42 days of no cases. WHO has declared that there are no more countries of source of infection. So for those who are asymptomatic but with contact, we'll monitor them for 21 days. But those who had contact and are symptomatic, then we will manage them. That means they will be sent to the nearest health facility. And throughout the country, we have isolated 21 hospitals, which will be the initial place for referral, including Sabah and Sarawak and Peninsular Malaysia, for testing and observation. And subsequently, those who are positive, they will be managed in 3 hospitals. One is in Sungai Buloh, one in Kota Kinabalu, Hospital Elizabeth, Queen Elizabeth, and Hospital Umum Kuching in Sarawak. So these 3 will be the designated centers for management. And in the management, of course, we'll follow all the protocols according to the WHO and CDC, where they will be managed in isolation in a single room. They will be taken care of dedicated teams of doctors and nurses who are trained. And all these staff are undergoing training now itself in a simulated exercise that in case it happens, how they're going to handle it, right? Including the infection control processes which we need to do to ensure that there's no spread of disease. If there is a person who is positive and we have got reasons to believe they have come into contact with Malaysians, then our surveillance team put a contact tracing for all people who could have possibly come into contact so that we can identify them, examine them, check them for evidence of disease for the 21 days post identifying them. So these are the processes which we have put in. Apart from that, on the global scene, we have already donated about 20.9 million gloves to the affected countries. Today in Cabinet, I also raised the need for further assistance. In principle, Cabinet has agreed that we will continue aiding these countries. I will discuss this further with the Ministry of Finance to find out to what an extent we can further assist them, mainly in the form of provision of more equipment, gloves, gowns, and other related equipment. So we will make a decision of that in the next few days, so we can further give that assistance. At present, we are also assisting the CDC of Atlanta in management of certain data through our tele-network system between them and us. So in the data from the affected countries goes to CDC, and through that and to us, and managing this data in advising, surveillance, tracing, and other aspects. We are also studying in detail how we can increase further assistance and support. Okay? Is there any questions you want to ask?
Sri, you said that we started screening at entry points. What kind of screening? Is it body heat scanner?
Yeah, it's a body heat scanner. So as they come in, I mean, it's been going on it's not only now, we have done this from the days when, was it the SARS?
Yeah, H1N1.
From H1N1 and SARS. So from that time, everybody who comes out just before the immigration point, your body temperature is actually screened, and if you have high temperature, then you'll be identified and called. Right.
Yeah, we do have. Yes.
We have. So the most important thing as far as Ebola contact is concerned is their travel of their history of travel, particularly to the affected countries in the last 3 weeks. We are concerned with asymptomatic people, that means those who don't have symptoms. And so we have asked the immigration in our multi-sectoral discussion that they have to look into the passport to see where these people have actually traveled in the last 3 to 4 weeks. And we have evidence in the last 3 to 4 weeks they have actually gone to any one of these countries. Then they will be sent to the quarantine center within KLA, means KLA. There our health staff will actually go through a prolonged questionnaire asking them of their contacts, where they came from, how they feel and all that. There will be detailed investigation. So the only area is about Malaysians coming back. This is one area of concern which you have. Malaysians coming back from that area, because they won't go to immigration counter, they will go through the auto gate mechanism. So if they are asymptomatic, we are thinking of putting up a counter just after the auto gate or before the auto gate, in which they will be given pamphlets advising them if they are coming from these countries, please report so that we can actually monitor them. So that is the one group which we thought we might miss, particularly if they use the auto gate. Okay?
Support.
All those things you mentioned, all the efforts. Well, I think we have, in terms of preparing the staff, getting ready, and of course controls, we have put in all those mechanisms which we necessarily have to do, and it's more or less fulfills most of the requirements stipulated by WHO. Yeah? Yeah, we always had our health teams in the airport. So that team, not only medical officers, public health assistants, and other public health staff who are now involved in this. So they, the moment a person either has got fever or a person who has comes from these countries, they go to our quarantine center. the health officers, the health team will actually assist them in filling up the questionnaire and ask those questions which are needed. There, I mean, in the causeway, it's quite okay. We still have screening in the causeway for those passengers who walk, except those who come by cars or bus. Even those bus, they get down, they have to go through immigration and come. Except for those who go by cars, they don't get down. So that is one small risk in that if they go by a car, we might miss that category of people. But in the Thai border, the busiest borders are Padang Besar and Rantau Panjang. We have told them to put in similar systems in that two areas too. While those areas of weaknesses which we have identified, we are trying to ways how we can strengthen it.
Equipment assets.
Pardon?
Equipment assets.
Human asset, as far as managing, I think we have got enough people who are trained in control of infectious diseases. The head of the infectious disease discipline within the Ministry of Health, Dr. Christopher Lee, is sitting here. He is the one who will take charge of preparing the entire thing. And we have nurses who have been specifically trained in the area of infectious diseases. So these are the people who will actually manage it. So in terms, and they are now undergoing simulation exercises in case a real case, how we are going to manage it, including we have run through the whole protocol, including not only the nursing and medical staff, the other components which are associated with it, so that we will be able to actually handle this, including lab testing, transport of lab material, waste management, management of the dead, all those things, so that we can do it in a proper manner. That is not an area of concern at this particular point, because as you know, the person under investigation as far as Ebola is concerned is a person who has got a history of travel to these countries and who has minimum that, plus of course if symptoms are otherwise, and contact with a person with Ebola. So that is what we are trying to manage by managing the entry points, because that is the most effective way of managing it. So, and strengthening it. The other thing is, all those entry points where there's a chance of these people coming, we want to catch them there, and from there take on the thing. Okay. Hajj people don't come from this area. So, and either the Hajj areas are not considered as Ebola infected areas. So that is not, but we had one case of MERS-CoV before, but they undergo the normal screening for fever, and we have got a very active medical team there itself, to which most of these people actually report to if they've got any problems with health. And that team will look into and help assist us and support whether there's any problems in health from any of the Hajj travelers are concerned.
It's not a suspect.
No, that was actually, that's why I have advised medical professionals to actually understand what is meant by a person who suspect Ebola. A person who suspects Ebola, apart from having the normal symptoms of fever, weakness, muscle pain, headache, sore throat, vomiting, diarrhea, or bleeding tendencies, they must have in the past 21 days come into contact with a person, at least gone to a country where there is Ebola, minimum. Further to it, come into contact with somebody who had, either alive or dead. But that Zimbabwe student did not fit into that definition at all. He last went to West Africa 6 or 7 months ago. So he didn't feel, so it was actually because the referral doctor raised the suspicion, we had to go through the entire process to make sure the person didn't have. So he did not fit into the definition.